Good evening, everyone, and thank you for taking this time today to join us for this informational town hall meeting. I want to make sure that you all are staying encouraged right now, and if you're of a praying people of faith, please continue to lift this community and our nation and our state and our county and our city in prayer. Today, we're going to have some information that hopefully is going to be edifying and education to help get us through this pandemic. Today, we have joining us the great Lieutenant Governor of the state of Michigan, Mr. Garlin Gilchrist, and I want to make sure I thank him and our Governor Gretchen Whitmer for doing a fantastic job leading us through these very trying times. Also, the state representative from the 34th District, Cynthia, our Neeley, are here first. Also, be joining us today is Anita Steward, the Deputy Superintendent from Flint Community Schools, so we can get updated and get good information about what's going on with our school district and our young people. And also the coordinator, our sheriff, Chris Swanson, will be joining us, as well as our Dr. Lawrence Reynolds will be here today. But we want to make sure that we get all the good information to you so you can protect yourself and your family through these very trying times. And you also have to be involved in the fight against this very deadly virus that's trolling through our communities and our states and our country right now. And I want to talk to my friend, Garlin Gilchrist, Lieutenant Governor. I know that you and the governor are making some very powerful moves in the state of Michigan. The governor has just announced another powerful move today. And if you can enlighten some of the constituents inside the city of Flint and Genesee County about what's going on stateside and what we can expect moving forward.
Certainly. Thank you, Mr. Mayor, for your leadership and for bringing all of us here together. We can keep people informed. Who's participating in this call and who's listening in, I want to thank you for your participation and for your vigilance. I pray that you all are staying home and staying safe so we can save lives. And I thank you for being beacons of information in the community. One of the things that has been happening with everybody being so, frankly, frightened by this unprecedented pandemic is that there's a lot of information flowing about, and a lot of it, frankly, is not true and is even more frightening. And so I appreciate all of you coming to get factual information so that you can share that information with everyone who you're connected to in the community. Know that Governor Gretchen Whitmer and I are working hard every single day to carry responsibility, which is to protect and promote the public health and public safety of the people of the state of Michigan. And we can only do that if we are in partnership and relationship with all of you, as well as the elected and appointed leaders who are on this town hall. Continue to work together in the spirit of unity, and that's why we're taking. This afternoon, Governor Whitmer announced the update to our stay home and stay safe executive order. The reason that we have enacted that order, the reason we enacted it in the first place, and the reason that we have extended it until is because we want to make sure that people understand that the way for us to slow the spread of this virus is by limiting unnecessary activity. It spreads most effectively through person-to-person contact in close quarters and close proximity, particularly indoors. And so by limiting non-essential activities that people are doing, you can help us slow the spread of this through our communities. That will save lives. That will ensure that our healthcare systems do not get overrun and overwhelmed the way that they have been in other states and in other parts of the world. It also will allow us to get more equipment for our medical professionals and our first responders in there so that we will have the capacity to respond. It enables the state to continue our work to set up care sites for COVID-19 patients should our hospital system reach that tipping point. It will also help us get more time to increase the testing capacity for communities. One of the things that is so dangerous about this virus is the fact that a person can carry it for up to 2 weeks without even showing symptoms. So people may have the virus and not even know it and be unknowingly. That is why it's important that we take aggressive action to slow the spread of this virus. I want to thank Mayor Neeley for his leadership and for being a proactive municipal leader by taking steps even beyond what the state has done to ensure that the people in the Flint community are safe. This is particularly important because one of the things that has become evident is that this virus is particularly dangerous, particularly deadly to communities of color, and particularly Black communities across the state of Michigan. Certainly, I'm speaking with you from my home in Detroit, Michigan right now, and that has become the epicenter of this outbreak here in the state of Michigan, but it's impacting Black communities across the state, including in Flint and Genesee County. And that is why, because of that disparity, because of that disproportionate impact on communities of color, I am chairing a task force that Governor Whitmer announced today that will be looking into how to respond to those health disparities that have been made evident and made plain by the COVID-19 pandemic. We know that this virus has had the reality of attacking disparities that were already present in our healthcare system and in the way that our people experienced it. Either people who were not connected to the healthcare system at all, you don't have a doctor or don't have insurance, people who've had pre-existing or chronic conditions like diabetes or high blood pressure, particularly vulnerable and susceptible to this virus. And those are things that are rampant in the Black community. So myself and healthcare experts and leaders and legislators are going to be taking a look at how we can respond to this immediately and how we can put things in place either through executive action or legislative action that will lead to the long-term shrinking of those disparities. I also want to note that this is another place where the city of Flint has been able to be a leader in looking into and building capacity to respond to disparate health outcomes, but the health outcomes disparities clinic that already exists in the city, that already has funding, and we're so work with that clinic through this task force and others like it in communities across the state of Michigan. So my role here is to make sure that people understand what is true and that they can be informed when they make their choices to stay home and stay safe. We are working to expand the safety net that will enable more people to do that. We've expanded eligibility to unemployment insurance. We've expanded eligibility to health care through Medicaid and other mechanisms. We have made sure that people will be able to keep their jobs, small businesses, by offering in partnership with the federal government paycheck protection loans to small businesses, even the smallest businesses, sole proprietorships, barbershops, the smallest businesses in our community can get forgivable loans from the federal government that will allow them to keep their people hired, to keep their people paid, to pay your business's rent and utilities through this time. You can find out more information about that program at mipaycheckprotection.com. I launched that on Friday. So we're trying to put things in place to take care of people. And we need you to be beacons of information, as I alluded to earlier, and we need everyone to do what they can to do their part. I want to say, one more thing about one of the outcomes, I think, of this virus on our communities. The irony of social distancing, it reveals how connected we truly are. During this, it's been made plain that the actions that we take have a direct impact on our collective community health and well-being. Because that is why we have to be mindful and do our part to stay home and stay safe so that we can save one another's lives. Emerge from this pandemic, when we establish our new normal in Michigan, we will be a better connected people. Our community connected is how reliant we are upon one another. And I believe that will lead us to check in on one another more, to take better care of one another, to look out for one another. And that will be the sunshine and the rainbow on the other side of this storm. We will only get there if we work and stand tall together. So thank all of you for the work that you're doing in the community. Thank you, Mayor Neeley, for your leadership in Flint. And thank you to the other leaders who are representing the city and the county, and all of you who are representing, frankly, all of our people across the state of Michigan. You're making us proud, and we're working hard alongside you every single day.
Yeah, also we State Representative Cynthia Neeley from the 34th District, which represents most of the city of Flint, and Lieutenant Governor Gilchrist, I want to thank you and the governor for doing all the hard work, but I wanted to assure our constituents here and our residents here inside the state of Michigan that you guys have not forgotten about any county or any city, especially the city of Flint, and the resources are being made and are being made available, and working with the legislators. I know earlier this week, the legislators convened to have a special meeting about extending the level of emergency and the shelter in place. And we turn our focus now to State Representative Cynthia Neeley from the 34th District, and she was there. You were there, State Representative, and we turn our focus to you, and then we'll ask our Lieutenant Governor one more question, then we'll release him for our other guests.
Thank you for having me, Mayor Neeley, and it's good to see you, Lieutenant Gilchrist. It is wonderful to be here and to be a part of this town hall meeting. I just want to first of all, just thank our firefighters, our healthcare workers, all our frontline workers that are out there that's doing a wonderful job to make sure that we are staying safe. One of the things that Mayor Neeley did say to you that we did go down on Tuesday to cast a vote to make sure that we support our governor and our lieutenant governor, who is working very hard to make sure that things are safe here for us on the forefront. I am just happy to know that our governor is working really hard for us on the front line. And me as a legislator, we're just doing our part to make sure that we support you and the lieutenant governor. We as a community have to remember that social distancing is very important. It's important that we stay home and stay safe.
State Representative Neeley, let me ask you this, because Lieutenant Governor engaged and talked about the healthcare disparities, especially the new task force is going to be led by him. I know in the city of Flint that there were new dollars delivered last year, and those dollars are being moved into action right now, using Flint as a pilot for the healthcare disparities, especially in communities of color. And I know that you're working very hard, making sure that those dollars are being put into place. And how are those dollars going to be used, and who are your partners with that, and how can people engage?
Thank you for bringing that up. Our partners that we have engaged on that forefront is Hamilton Healthcare and First Trinity Church. We are working very hard. This will be the first site for this task force. Governor Whitman came down a couple months ago to help us introduce the clinic. And we're just excited and working very hard to make sure we can get this for our healthcare disparity. We know that Blacks are losing their lives in this critical time, and we just want to make sure that we're doing our part on the state level to make sure that we're making sure everybody is safe.
Right. And Lieutenant Governor, I know you're on a time schedule, and you guys are up at making conference calls very early this morning with the Michigan Legislative Black Caucus and others talking about this task force is going to be engaged by you and the governor. But now is in the city of Detroit, and we want to make sure we get good information. We're going to be spreading the good information out. But in the city of Detroit, which is the epicenter, Michigan is at the third highest level of impacted people now in our nation. What is it that we can learn from our experiences that's happening in Detroit? So cities like Pontiac, Flint, and Genesee County, Wayne County, Oakland County, what can we learn? And what can we do to brace for the impact of this as we look at the precipice still to come from this virus?
Yeah, I appreciate that question. So there are a few things that we are trying to put in place here in our state's biggest city that will reverberate and that can be modeled in other cities across the state. And one of them is the way that we approach setting up an alternative care site for COVID-19 patients. And so we set that up at the convention center in downtown Detroit called the TCF Center. It's been set up in partnership with a number of our regional healthcare providers and hospital systems, as well as the Army Corps of Engineers and the Michigan National Guard. And I know that same partnership between the Corps and the Guard are looking into possible alternative care sites in Genesee County that could perhaps be staffed by Michigan. And they're looking for sites that could be helpful in case there is a need for an alternative care facility there. The reason that's important is because by working to move the COVID-19 patients off-site to a specific place, you're also protecting the healthcare workers and the patient hospitals for other reasons, and not potentially introducing COVID-19 into those environments. So that's one big lesson and one big takeaway. The second is something that we are focused on really like a laser at the state level, and that is getting more testing capacity into the state of Michigan and color. Particularly, the reason that's important is because we need testing in order to really measure and understand community spread. So we're trying to get testing that works faster, that is more reliable, so we can test more people, including people who are not yet showing symptoms. That is the only way that we will understand community spread. But we haven't been able to test asymptomatic people to the level that we need to because we haven't gotten enough testing capacity yet. We're working on that now. And so as we increase the pipeline of tests, both from the federal government and from the private sources that we're procuring them from, we're going to make sure that they're present in communities of color across the state so that we can get ahead of this pandemic and get ahead of those disparities before they come and impact more communities in the way that they've impacted Detroit.
Now, on a state level, because that's one of the big questions that we have here in Genesee County, providing those level of testing. And we know that every sector of our country right now is strapped for resources and making sure that we have those kits, the testing kits, and making sure that we have a fast response to turnaround time to either clear a person or not clear a person. Is the state making resources available? Can we expect more help from the state trying to secure more testing equipment and more tests, especially for counties like as you move north in our state?
That's absolutely right, both on testing as well as with personal protective equipment that we've been ordering from every source, not just the Strategic National Stockpile, but again, also procuring that from around the world and making sure that with the help of the Michigan National Guard, we're able to efficiently and quickly distribute meals across the state of Michigan, including to places like Genesee County. So that's something that's a big priority for us because, again, this will help us understand the spread, help us respond to that spread, spread, so we can think about how we can get back to and establish a new normal for our lives and our community. That's something that is what the governor and I and our team are thinking about every single day, and know that the state is working to deploy resources as well as information that you need to respond locally. We're also working in partnership with our federal delegation, including Congressman Dan Kildee, who has been a leader on these issues, to ensure that we can draw down the maximum amount of resources that we can leverage here on the state level. That's going to be critically important because we're spending a lot of money on the state level, and we are asking people to slow down their economic activity, which is going to impact state revenue. And so we're going to work with the federal government to fill that. We are working, and we're not holding back right now because our communities need these resources and need this information, need these testing kits, need this personal protective equipment, need everything that they can, and it's all hands on deck moment to respond to COVID-19.
Right, and I just wanted to make sure that we reassured our residents inside the state of Michigan that we're working collectively and collaboratively to make sure that we fight this with everything that we have, and we have to include them into the battle from our faith-based communities as well as our governmental units. And I want to make you have been such a great partner in this, especially for the city of Flint. State Representative Neeley, with the new clinic that's coming and the medical facility that's being established for the healthcare disparities, when do we anticipate those things and those dollars being activated for the betterment and empowerment of the community through this pandemic?
Well, Mayor Neeley, we're looking at that clinic to start up in late May. We're working really hard now to look at the budget and to make sure we have the right facilities and all the equipment and everything that's going to be there. So we're working very hard to make sure that we can get it up sometime mid-May.
Okay, and with that, Lieutenant Governor, is there anything that you want to leave and impart with our residents inside the state of Michigan to provide them with a level of comfort or through this very traumatic time? Because this community has been hit very hard over the last 6 years. I like to refer to it as a crisis on top of a crisis with a side of crisis. And we're just in our 5th month of office, but we're doing a very good job in trying to make sure that we include all of our partners for the empowerment of the residents. And is there anything that you want to leave? I know I talked to the governor maybe once a week, and I give you a call, you pick up, and we move things pretty fast. And is there any good news that we can expect very soon about the relief help that's coming from the state for the Genesee County?
Yes, please know that the city of Flint, Genesee County are all very, very important to Gretchen Whitmer and to me, and that we are not only thinking about but working on behalf of communities every single day. I mean, look, I was before, it was just days before we had our first case in Michigan, and actually a few days after that again as well. So This community matters. We are working hard every single day to make sure that you have what you need to respond to this in the best way possible so that we can get through this together. You have partners, you have allies. There is a new day in government, and we hope that trust and relationship can continue and can deepen in the midst of this crisis. Often challenging times are what bring people and communities closer together. And I believe that this pandemic will bring this community closer together, and it will strengthen relationship with you as well. We are working to get the resources. And if there are other things that you need, I know that there are some unique circumstances and challenges in your community. Know that your leadership, Mayor Neeley, Representative Neeley, they're working very hard and making sure that we know what the needs are so that we can channel resources in your direction to make sure you have what you need to, again, to pull through this pandemic. We have your back. We are at your side. We are going to walk through this together, and we're going to be proud when we get to the other side of it as survivors. We will be able to remember those who we've lost and build upon their legacy in a really powerful way. And so I thank you for being resilient, being courageous, and stepping up in this moment, and stepping up right there with you.
And thank you, Lieutenant Governor Garlin Gilchrist, once again for your leadership with Governor Gretchen Whitmer and State Representative Neeley. We'll be giving out information, and we'll be taking a few Facebook questions with our next guest as we start the portion of disseminating information about where people can get help and where they can go find the resources that they may need at this very trying time. Lieutenant Governor Gilchrist, is there a number or website for the state of Michigan that people can go to be able to find the information from the state?
Yes, there is. You can go to michigan.gov/coronavirus. That is michigan.gov/coronavirus. That has all the information about everything from the statistics that we release every day at 2 p.m. To the latest on the executive order, including the updated stay home, stay safe order that we announced today. Information about the task force on racial disparities that I'll be leading. Information about how people can safely volunteer or contribute to the response effort, and everything in between. So please check out that website for resources on how small businesses can participate in the Michigan Paycheck Protection Program. Everything about our state's comprehensive is there at michigan.gov/correct.
With that, thank you. Representative Neeley, do you want to thank your partners again as it relates to all the great work, because we cannot forget the frontline fighters that's engaging in this. Our healthcare workers are nothing less than heroes as they take care of our sick, and they jeopardize their health and their family's health as they provide this. And we definitely want to make sure that we reach out to them. Is there any words that you have or encouragement for them, Representative?
I want them to know that we are supporting them, we are behind them, and I just want them to continue to fight and to know that the state representative behind them and the community of Flint is behind them. And I want to thank the governor, and I want to thank the lieutenant governor for just being the great leaders they are. My office can also be reached if you have any questions or any concerns at 844-463-3539. That number again is a toll-free number, 844-463-3539.
Thank you for that. And as we switch out to the next informational portion, I want to thank you, both of you guys, for joining us. And next up is Anita Steward from the Deputy Superintendent for the Flint Public Schools, so we can get the good information out to those residents that have children inside of K through 12. And we want to make sure we're going to be reaching out to also our Sheriff, Chris Swanson, to get information about the emergency response as we look at what we're moving toward. And we're going to be putting up a few slides. And thank you, Anita, and thank you, Chris, for joining us. And thank you for the hard work that you guys are doing. We're going to start out with Anita Steward, Deputy Superintendent for the Flint Public Schools. You guys have been feeding students throughout the city of Flint as school has been shut down, for the lack of a better term. And Anita, can you tell or give parents information where those sites may be to pick up food for their students, and also talk about what's going to happen as we continuously try to make sure our kids still have a level of education to move forward?
Absolutely. Thank you, Mayor Neeley. Thank you for this wonderful opportunity to share with you and the community regarding what Flint Community Schools has and is doing. So in our meal distribution and making sure that our students continue to receive breakfast and lunch, we're using a grab and go meal distribution system. Sodexo, our food service provider, has served close to 4,000 meals a week. We have 12 sites around the city. We have 4 sites that are currently on the north side. We have Northwestern, Brunel Homes, Burston Fieldhouse, and Carpenter Road. We also have 4 central zone sites, Potter, DTM, Stonegate, and Summerfield. We have 4 south zone sites, Freeman, Howard Estates, Evergreen Regency, and Southwestern.
Right, and moreover, I know you're reaching out to students and parents right now to make sure the school year doesn't go with kids just sitting at home idle for these periods of times as we observe the shelter in place. What type of activities are we moving toward to make sure that kids are still getting a level of education? And how can parents reach out to you at the school district or the school district to get the level of service or needs that the schools usually provide on a Monday through Friday basis?
We are currently working on an academic plan to deliver instruction via multiple modes so that students can still access learning. We're using a blended learning approach using online and paper learning packets. Online learning using an online platform the students are familiar with or were already using prior to school closure. Teachers will manage and monitor the learning by pupils with the assistance of paras starting next week on Monday. Teachers and paras will also have at least one touch point a week with students and parents, checking in with them to see how things are going, to see if there's any issues, helping them navigate the issues. If students have any questions, they'll have that touch point with the teachers so that they can kind of work through that. There will be the online interaction back and forth between the teacher and the student. For example, that one touch point with the teacher may be a Tuesday. So teachers will be reaching out to parents starting next week to let them know the day that that touch point is going to be for them. In partnering with GISD, we will continue to distribute learning packets. Starting Monday, families will receive them weekly. So please stay tuned for more information next week from your child's school and or teacher as to how you can get your learning packet if you're not taking advantage of the online learning platform.
Is there a phone number that they can call, Mr. Steward?
There's not a phone number, but there is an email address that I would like to give you. If you have any questions or concerns, please contact Flint Community Schools at superintendent@flintschools.org. Once again, that is superintendent@flintschools.org.
And thank you for that. And now we move to the chairperson of our Emergency Operational Center, the great Sheriff Chris Swanson. And thank you for your partnership in this. And we have a lot of information to give out, tactically as we're moving forward to be proactive in the fight against COVID-19. And Chris, thank you. And if you want to update us, because people need to understand how the emergency declarations are done. The city's under a declaration of an emergency, the county's under a declaration of emergency, and also the state is. But once that happens, we have a coordinated effort with task force members of emergency coordination, and that's led by you and your team. And we're a part of it as the city of Flint, as well as all the other villages and townships and cities inside of the county. And if you can update our constituents and our residents about what is going on and what we're doing and how we're moving proactively to safeguard their lives.
Well, first, Mr. Mayor, thank you for inviting me. I'd love to see the collaboration. As a personal note, my parents live in the city of Flint, and we are in good hands having you as the mayor. We talk, you and I, virtually every weekend day, Saturdays and Sundays and evenings. And I want the folks to know in the city of Flint that you got a mayor that cares, you have a team that cares, you have a Genesee County that cares. We deal with things every single day, like the whole state and the nation is dealing with, that change. You come in some days thinking you're going to do something, and then the plans change, and you have to have that collaboration, those good contacts, those good relationships in order to adapt with it for the good of the people. So I appreciate that. And I will say, when the state of Michigan declared an emergency, it's many times followed by the local jurisdictions. And the city of Flint was the first to follow locally, followed by Genesee County. And really that does is it dedicates the efforts and the continued support from all the social services to a specific issue. As many that are watching right now could recall back to 2016, when it was declared an emergency for the water crisis. And immediately that opens up resources and it brings attention and allows those social services to be more flexible, and it pours resources in. And that's exactly what happened when we declared this emergency in March of 2020. And I will tell you that emergency operations involves the entire county, which includes the city of Flint. It's funny how some people in the out county don't realize how valuable the city is to the entire county and vice versa. There's 25,000 people in Genesee County, and all of them deserve the same ability to have resources, the same ability to be dignified, to provide the social services. And that's what emergency response is. This is not like the floods that we've had or the tornadoes we've had or things like this. As you know, this is a unique enemy, but we have to have a plan in order to give the services to the people that need them. And what we found for our friends that are watching and listening right now is the needs are some that we've never planned for, including what the hospital needs, those healthcare workers, our EMS, our police, fire, and ambulance personnel, but also the overwhelming demand on our social services, Red Cross, United Way, Catholic Charities, My Brother's Keepers. You go back to Carriagetown that take care of our homeless population. All these organizations need to be supported by other organizations because not one can do it themselves. And I will tell you that with the needs that we have, all these numbers that you're hearing and all these contacts, not only from the mayor, from the schools, but also Representative Neeley, these are places that people can go to get help because everybody has a unique need in and of themselves. And what may be important to me may not be important to my neighbor, but they're still both important. And that's what we as emergency managers look at to find out how to take care of all those. We've involved the Flint schools, the GISD, the city of Flint, all our local jurisdictions, and all those places that we talked about. And that task force mentality is we've got an immediate problem. We've got an enemy that's facing us right now. So what needs do we meet right this minute? And it goes back to Maslow's hierarchy of need. Food, shelter, clothing, and I think this may started our partner with the mayor's task force as far as providing these social services. We've answered 3,200 calls for service. We're talking calls for people that it's not that they can't afford things sometimes. They can't go out there. It's a logistic issue. They're scared to go out. These are folks that maybe haven't had the meals that they have asked for because those social services have suffered some type of loss of personnel. And of those 3,200 calls, we've already serviced 2,000 households, nearly 85% of them being inside the city of Flint. We've had 3 semi-trucks of water that are being delivered to all the people that need the bottled water. That's a big concern on the city of Flint's administration. And this is a startling fact. This is just 300,000 pounds of food have been distributed through the 9 hubs we have and the additional food resources that are being put out through the city of Flint. So all these things happen. The Emergency Operations Center, which is just south of the county jail, it's led by our emergent operator, Wilson, our major Dave Stain, a whole slew of support services that are on. And then what we do is the people from the in that emergency operator, such as the mayor, deputy chief Devin, to be the queen, the city of Flint, so that they can be informed. Every day when we referred it, there was a 10 o'clock. We did it virtually. Now those partners are up to 40, and we do it Wednesday, Friday, because we was organized plan. The system, we look back, there's a plan for the plan for the plan. What do we do with this population? What do we do with this? How do we handle this? And if they never come to pass, then we've done our job. Because our goal, just like the Lieutenant Governor said and all your other colleagues, we want to make sure that the folks know that these public servants are always looking out for the best interests, and collaboration and the great minds put together can make that happen.
Right, and now as we just see now, Chris, is that a slide just came up, a number of cases inside of Genesee County, and this is on the uptick in the health community. They're predicting that we have not reached the peak just yet, but what we have to do is recognize the level of how this disease is spread or this virus is spread, and under the executive order by the governor, the shelter in place, and also the curfew inside the city of Flint between the hours of 9 p.m. and 6 a.m., people have to adhere to these things in order to make sure our cases flatline. Chris, what are we doing on enforcement as far as a county, especially our emergency team response to this. And then we'll talk about the distribution of water and food, especially to the residents inside the city of Flint. But in the out county area, I know some things are being done, but in the city of Flint, how are we looking and what is happening in our local jail?
Well, it's a great question. I might add to that stat, and to your point, 58% of the deaths that we've had with those stats are African-American and 33% Caucasian. So to your point, there is a great void there that I'm happy that the task force is formed to find out how do we fill that. Even Governor Cuomo was talking about how he can, beyond this, look at what causes that spike in the African-American and Latino community. So that's very important. And I will tell you this, as a law enforcement professional for my entire adult life, we've seen a very, in the city of Flint and around Genesee County, where people just kind of setting, in a settling moment where they're not out there doing many things, or kind of just taking it easy. We haven't seen a spike in crime. We've actually seen a reduction in a lot of property crime. A bit the mayor speaks about is people that just don't take that stay in place order serious, which is why you were aggressive. And we talked about it the day you put it out last Wednesday to take effect for that curfew on Thursday of last week. And I said that was a sensible move because it works for the back of the bricks to keep things tempered. And many times you need to give a little bit of a push to let people know that by you staying in place and staying sheltered, it's going to help everybody. And it's in my faith, great working department, as well as the sheriff's office and other state police officers, to do an inform, a teaching, a conversation for people that are congregating in parking lots after 9 o'clock. But ultimately enforce them with the city ordinance of a 90-day misdemeanor that's issued by the city of Flint Police Department. And we have had, and I will tell you, in the last week, we've had no issues with people that have challenged that. People have been very accepting of it. So the curfew was a great move to show that the city of Flint is serious about this, as is the county, as is the governor. And the more cooperation we can get for the people on the street, then the faster we'll see that peak and that decline, which is what we spoke of. And I see that. I'm happy about it, and we have a good path that we're going down right now.
Now, also, Chris, I want residents to know that this may cause a small inconvenience or not popular moves, but we have to be very aggressive because this virus is unforgiving. It doesn't respect borders. It doesn't respect ethnicity. It doesn't respect economic status. We see big box stores like Walmart, Home Depot, Sam's. They're limiting the number of people that patronize their business at a certain particular time. And so we're going to ask right now, I'm asking the residents and business owners, the consumers, as well as our business partners, to please acquiesce to the request of the governor and also the will of the city of Flint to be able to slow the spread of this virus so we can get a handle on it. Now, as a mayor, as executive of this community, I don't want to be forced to shut down parks because children are playing in parks and parents are not observing the shelter in place. I don't want to limit by mandate the number of people that's congregating in party stores. I don't want to have to do that, but I will make those bold decisions and those bold moves and enforce them if it means that we can save at least one life. This pandemic is real. Two of my neighbors have been hospitalized. We've lost this past week Dr. Bertley, which was a superintendent of Flint Public Schools for 19 years. We lost a labor leader, Reuben Birch, to this deadly virus. This is real. This is real. And so churches, you're still having service. Please, I know we're observing our religious week here, and I am a strong member of faith. Please close the doors to your churches. We don't want to have to do bold, aggressive moves. We need everybody to be on board to slow the spread of this virus. Criticism is being spread around a lot, but we have done some really fantastic things as a partner, working with the Sheriff's Department, the Flint Public Schools, with our state government. We have been doing this, but we need the partnerships from you, the residents. Wear a mask on your face. Adhere to the things that we're telling you, because these are the best practices in the slow the spread of this virus. We have to learn from the experiences of other communities: Detroit, New York, Washington, D.C., Chicago, We don't have to have a loss of life in those
That's right.
catastrophic numbers in order to get these things done. And so, Chris, I know we're doing some things. We talked about the water delivery. The Oak Business Center now has been changed to a headquarters from a business center to a site where we'll be staging, delivering water to the most vulnerable. And they can call the number 410-2020, 410-2020 in order to be able to get water delivered to them. And so as we look at these rates of these cases, and I know Margie Raymer, our comms director, is doing a fantastic job because this is an unfamiliar technology to us, is reaching our constituents this way. But we're doing the best we can and recognizing our own shelter in place, and each one of us are in different locations doing this. We also have from the Oak Business Center that will be delivering food and water to the homebound, people that cannot get out. I know sometimes we're tempted to just make that phone call because you don't want to wait in the line to get water, but this is for the most vulnerable in our community. And so that will be delivered to their homes for those that cannot get out. We have 3 help stations throughout the city of Flint. We want to thank members of Bethel United Methodist Church. Harold Woodson is there doing a fantastic job, and that's located at 1309 Ballinger Highway. Also, Asbury United Methodist Church, which is located 1653 Davison Road, and Bethel operates Mondays from 10 a.m. to 2 p.m. Ashbury operates on Tuesdays, 10 a.m. to 2 p.m. But I suggest that you get there early because water is limited and it's first come, first serve. And the Greater Holy Temple, Bishop Jones and Mother Jones is doing a fantastic job over there, providing food and also the commodity of water for those residents that may need it. And that is on Thursdays from 10 a.m. to 12:30 p.m. And so we also have water box locations, which was donated by the Will Smith family, Jayden Smith, the Lennox Center, which is 2101 Lewis Avenue, and they're open from 4 to 7 p.m. And the water box is where it gets an extra filtration system that will give people a water that they're confident and comfortable drinking. Metropolitan Baptist Tabernacle, which is 931 East Myrtle Street, and that's from 3 p.m. to 6 p.m. Also, First Trinity, Lady Tillman and Pastor Tillman, and I did that in backwards order, Pastor Tillman and Lady Tillman. I don't want to get in trouble there, but they're located at 1221 Beach Street, and they're open from 10 a.m. to 1 p.m. on Wednesdays. And so we want to make sure that people understand about these the access to information as well as the things that they need. And I also want to thank Sarah Houston. And when you look in the top left-hand corner of your screen, she's from the deaf and hard to hearing community. She's been doing a fantastic job with us. And Anita Steward over there, you've been feeding kids throughout the city. You started out with 22 sites. The school district faced a little bit of criticism for reducing it down to 7, but it was a fantastic move to make sure that people gets the commodity they need, but also operating in the capacity in which you can deliver the meals. Can you tell them again, once again, when those meals are being delivered to the young people, and also where are they?
Absolutely. Yes, we decreased the sites down to 7, but then we added some sites and we're back up to 12. So we have we are now up to 12. We have 4 sites that are on the north side of Flint, and those sites are Northwestern, which is G2138 West Carpenter Road, the Brownell Homes Campus, 6602 Oxley Drive, Burston Fieldhouse, 3300 Saginaw Street, Carpenter Road, which is the River Park Apartments, that's 7002 Pemberton Drive. We have 4 that are in the central location, Potter, 2500 North Averill, DTM, 1518 West 3rd Avenue, Stonegate, 3103 Stonegate Drive, Summerfield, 1360 Melbourne Avenue, the south side of Flint, Freeman, 4001 Ogama, Howard Estates, 1928 Howard Avenue, Evergreen Regency, 3102 Fox Circle, Southwestern 1420 West 12th Street. And Mayor, I think it would be at this point a good time to mention that effective Monday the 13th, we're going to be doing food distribution only 2 days a week. Previously, it was Monday through Friday. But to limit our contact with the community and their contact with us, we're going to be serving both breakfast and lunch on Tuesdays and Thursdays from 10 a.m. to 1 p.m. It's not limiting the number of meals that
And
they
thank you
get.
for that. You know, we're trying to get Dr. Lawrence. I'm sorry. Were you complete? I'm sorry. I don't want to step on you.
So they will still get the number of meals that they need Monday through Friday. It's just that we're limiting our distribution to 2 days a week starting Monday. And I just wanted to make that note.
Right.
Thank you.
Is there a web page they can go to, Anita, for the Flint schools to be able to look at, to try to gain more knowledge and information about what's going on?
Absolutely. It's flintschoolswithanS.org. Once again, that's flintschoolswithanS.org.
Wonderful. And Chris, while we're trying to get Dr. Lawrence Reynolds on, we're going to continue to have a dialogue with us and talk about what's going on inside the city and the county as far as the resources and making sure we get the resources. And then we're going to open it up for a few Facebook questions as they come in. But I want to remind individuals, the city of Flint has a curfew that's in place from 9 p.m. to 6 a.m. every day of the week as we monitor the shelter in place that was been given by the governor of the state of Michigan. The state of Michigan is in an emergency. The county is in an emergency. The city of Flint is in an emergency. And people, we need to take this very seriously. So we ask people in the faith community to make sure that they help spread the message of partnerships along this line. The only way that we're going to win and come out of this on the other side together is working together. And this is what we want to do as we looked at the things that's happening across our nation and across the country. They're expecting this to peak where 100,000 to 200,000 American citizens will lose their lives through this whole process. So when I drive past a basketball court and I see young people out there playing, I understand that children want to get outdoors and they don't want to observe this, but it's up to the parents. It's up to the responsible ones to make the irresponsible ones more responsible about this activity, because we can't not get through this if we don't observe all the best practices. So the recommendations from the health community is cover your face when you're out in public. Use a scarf, a mask, or make sure that we're practicing social distancing from one another so we can slow the spread of this virus. We want to make sure that we observe all other things that's going on. Now, we have critical infrastructure needs as well. We still have municipalities to run and the county to run and all the other things that we're currently doing. I want to make the announcement about things that's happening currently inside the city of Flint. Right now, if residents need help paying their utilities bill while resources last, the city of Flint will match you dollar for dollar up to $75. And I want to thank the city council of the city of Flint working with this municipality to be able to offer that, because we know it's hard times. People are been dislocated from their work and their jobs, and resources are very slim. And so we want to make sure that we understand that. So the Water Payment Assistance Fund is up to $75 credit on your water bill. You can apply for up to 3 months in a year. And so this is for low to moderate income people. And so I want to reiterate this, Chris, and you understand this, that sometimes the natural tendencies of a society is to go grab things just to grab them. But we want to make sure we protect the most vulnerable. If you have a single mother out there that's struggling, and Anita, you know this, we're working with young children that maybe 90% of the school district are free or reduced lunches because of the poverty track inside of our city. But let's make sure we take care of those individuals first. And that's why we initiated this program. And I want to once again thank my colleagues on the Flint City Council for helping with this and helping support this activity while the dollars last. Dollar for dollar match on your utility bill. But you have to call the number 410-2020, 410-2020. Also, if you know of people that are sick and shut in and cannot get out and they need a supplement of water, we want to thank the Nestle Corporation for stepping up to be able to give us an additional shipment of water once a week for a period of 30 days to be able to deliver. And I want to thank our volunteers that's out there volunteering to help deliver this water. Pastor Jeff and April Hawkins from Prince of Peace Church for being a partner in that. Pastor Monica from Salem, Pastor Daniel Moore from Shiloh Missionary Baptist Church. We want to thank our partners in this activity, and also those in the faith community that operates the help centers, Bishop Jones and Mother Jones at Greater Holy Temple. And we also want to thank Bethel United Methodist Church and also Asbury Church for being help centers for getting those individuals the water and the commodities in which they need. Now, Chris, also on the state level, on the county level, the Emergency Operations Center, which and people have to understand how that works and what are we working on, because right now we're really in a struggle trying to find the safe spaces for the homeless population. I don't want anybody out there to think that we're not mindful and we're not working toward a resolve for that. And Chris, do we have any information? Because we still have 3 centers that's currently operating. And if we have that slide, we'll put that slide up where the homeless population can go seek shelter.
Yeah, that's a great question. This is a project we've been working on for nearly 2 weeks now, and we just had a major fall through. The Holiday Inn Express, which was mentioned as one of the locations, pulled out just this afternoon, stating that it violates their franchise agreement. So we're almost back to square one. However, we are working with Carriage Town, My Brother's Keeper, Shelter, Flint, Catholic Charities to make sure our homeless population is cared for. And I have to be mindful that they have special needs, and we have to have a different plan. Many times homeless are mentally ill, so you have to have the mental health services for them. They have to feel as though they're empowered through their life. You can't put them against their will. So there's a really, really sensitive approach to doing this. This is a daily conversation we have with the city, and those services you have up on your PowerPoint now. I will tell you that they are still being fed. Catholic Charities is still doing their North End, South End soup kitchen. We are counting on a plan coming. And we're hoping, again, that population is not infected and doesn't have a mass epidemic. But Mayor, I wish I gave you a better answer, that we have a location, it's locked down, but we're working with Angela Wheeler, we're working with your office, we're working with all those, we're working with our corporation council, we're working with everybody to try to get things nailed down. But I will say it was a big blow today to have one of our locations that we narrowed down pull out at the last hour.
Right. Margie, if you could put that slide back up, we can tell people where that we can find shelter for those young people people that may find themselves in a transient position at Carriage Town Ministries, and that's 605 Garlin Street, Carriage Town Ministries. My Brother's Keeper, 101 Grand Traverse Street. Also Shelter of Flint, and that's 924 Cedar Street. They can find a place to keep warm and stay out of the elements there. We'll be providing them with the resources that they need. And also we're going to try to make sure we segregate the population to make sure we keep well people well, and
That's
then
right.
nurse people back to strength. We are working on this. This is unprecedented territory that we in. And I want to encourage everybody to be as positive as they can. And right now, while we still have you guys here, do you mind, Margie's going to pull up a few Facebook questions and we can try to answer the questions. I know people have questions about, we got Dr. Reynolds. Oh, my man, we've been filibustering Dr. Reynolds trying to do this, but before we take the Facebook questions, Dr. Reynolds, sorry to just pull you up right away, but we want to go ahead and talk about some of the things that's happening in the health community and what can we expect and what can we do in this pandemic. What can we do better? Dr. Reynolds.
Mayor, I've known you long enough to be ready at all times. So thank you. I'm not going to start off talking about coronavirus. I'm going to talk about what we need to protect our health, because there's more going on than just coronavirus. And in order to fight it, we have to take care of ourselves. And number one, if you're smoking or vaping, stop.
Yes.
Do not do it in the house. Do not do it around the ones you love. Smoking and vaping damages your lungs. So you don't want to help coronavirus, and you don't want to help it attack the ones you love.
That's right.
Number two, keep taking your medicines. Make sure you have enough medication. If you're getting low, call your doctor. If you don't have a doctor or you don't have insurance, you can go to Hamilton Family Health Network. They have 3 offices in and around Flint by appointment, or you can contact the Genesee Health System to get insurance coverage. Call your provider before you run out the door to go to the emergency room or the hospital. If you look at the numbers, less than half of the people who had positive tests were admitted, and you don't want to clog up the emergency room with something that could be handled by your doctor's or clinic's office. So please call your provider before you go, and if you don't have one, get one. Call Genesee Health Systems or call the helpline. Number 5, I think I heard the sheriff and others say this: stay connected. You can talk through a window. You can shout across the backyard fence. You can call on the phone, but look out for the ones you love and even the ones they're kind of sketchy. But this is the only way we're going to make it through, thinking about others. Everything that was said today talks about our responsibility to the rest of our community. The decisions we make, the good ones, help improve our situation. The bad ones not only put us at risk as making bad decisions, but it puts the ones we love at risk also. So we should be careful. And remember, you may hear a lot of things on television. There are credible sources. If you have a question, call the State of Michigan Corona Hotline. If you have questions, call the Genesee County Health Department. If you watch television, listen to Dr. Fauci. If you have more questions, call your doctor, because there's a lot of rumors going around. When this started, they said it didn't affect Black people. Well, look at it now. So you must have a credible source and don't believe everything everybody says. So if you are ill, you need to isolate yourself in a room in your home if you have that space. Ideally, if you have a separate bathroom, use that. If you're taking care of someone at home who has symptoms, fever, rapid breathing, dry cough, what you can do is, if you can make some kind of face covering for yourself and them, and wash your hands repeatedly. That is the main protection.
Now, also, Dr. Reynolds, we look at the numbers across the nation, and the health communities are projecting this to have a great uptick. And there are a lot of questions that we have been fielding about, and this is some of the misnomers that's being placed out there in the social network and the social media. We have people putting out sometimes toxic information that's not really good to the overall good that we can do together by working together to eliminate the spread of this virus. But also, they've been saying that when a person goes to the ER or the hospital, some are sent home to quarantine there. Can you answer that question for those individuals that may have been sent home, if that is actually happening? What is going on there? What have you gleaned from that?
Oh, yes. Some are sent home, and that's because their symptoms are not significant enough at that time for admission. Yes, this disease can progress rapidly, but yes, maybe that day there were far more people whose condition was more critical than yours, and who also had a positive test, or who had other complications that required their admission. So that's why it's so important, if you're sent home, call your doctor, call the helpline, call the hotline if your symptoms change. And the only reason you need to call 911 is if there's a drastic change. You find yourself totally out of it, so short of breath that you can't talk. Those would be reasons to call 911.
Now, also, Doctor, they've been also talking about, the limited amount of resources across our nation with the respirators and the PPE gear for those frontline fighters. And I know Sheriff Swanson and I, we've been disseminating the PPE gear through our first responders, as well as our healthcare providers and also our staff in many cases. I know City Hall has been limited. I have about 175 people working remotely from home. We have over 400 workers working for the city of Flint, and resources are scarce. But in the health profession, right now, we talk about equipment, respirators, PPE gear, and also bed space. Have we gleaned anything from our county? Where are we at? And Chris, you or the doctor can answer this for the residents so they can be eased by having good information.
Well, I will say this, talking to my colleagues and former colleagues, there is not enough equipment for offices. Some docs have had to buy equipment off of eBay because there's such a critical shortage. And in the supply chain, or I'll say the feed chain, the hospitals come first, the first responders come second, and just the way it is, if you're running an office or a clinic, you're on the third level. The whole world is trying to get the same equipment at the same time. And so that makes challenges for our city and our county and our state. And so when you have, what is the population of the world going for the same supplies, and you have people who can't work just like we can't work here in our jobs, it is a disaster. That's why they call this a pandemic. It is a worldwide problem. And I appreciate all the donations that people have made for our first responders, for our nurses. I'm the son of a nurse. I'm a retired physician. I'm the son of a police officer and the brother of a police officer. So we all have to work together to hold this community together until supply lines and supply chains are restored. Sheriff?
You know, that's a great point. And I will tell you, when we first started, there was such a demand and such a limited supply. And any PPE we get, specifically masks, go to the hospitals first, Hurley, McLaren, and Genesis. And on our EOC calls, they always give an update how they're doing with PPE. And right now, they're operating with a surplus days in advance. So as you say, hospitals are first line, then EMS. Our EMS is doing great. We have partners, both private as well as the sheriff's paramedics, that we're doing well with our masks. We just got a donation of it doesn't seem like a lot, but it's a big deal. Home Depot dropped off 6 respirators for our paramedic division, and they were given to those medics that have the highest call volume. We're doing the same thing with fire. Same thing with Flint Fire, and these PPEs are so vital. I myself have a mask that was made by a seamstress up in Vienna Township. I don't need a N95 like somebody else does, and the need will always be there until the supply is greater than the demand. And for that, we're grateful, but we still have a lot of room to go. You know, we have people that are delivering food and water that don't have PPE, but like that, you can make your own. You can put a mask, you can put out, do something to.
Right.
That's right. I have my shop rags and I'm experimenting as we speak.
Right. Well, now we're going to go to a couple of Facebook questions, and also we have our critical infrastructural needs as far as the payments that's due to all of our our mortgage companies, our taxes, our utilities, and many companies have made some changes in the way that they do business. I know that we have done that around the city hall. We have a big red box outside of City Hall so residents can make their payments there for their utilities, and also we have assisted them with a payment assistance plan. But we're going to open up to Facebook questions now. Margie, I see that you have joined us, and I want to thank the interpreter number 1, but I don't know his name. So I'm going to just call him interpreter number 1.
Miles. His name is Miles.
well, thank you, Miles, for doing a fantastic job. I see Sarah is back. And
Miles.
Yeah. So Margie, what is the Facebook audience asking us?
Sure, we've actually gotten lots of questions in. I'm trying to group them as much as possible to get to as many of the questions. And thank you for everybody that is writing in questions. One of the main concerns is actually about enforcement, and really people being concerned when they're going by establishments, seeing crowds of people. What advice can we give them? What can they do about it? What are police trying to do about it also?
That's a great question, because it's frustrating for me when I have business owners that are shut down and they call and wonder why this particular business is open. I will tell you this, it doesn't fall on one particular police agency. Law enforcement needs to stick together and enforce the governor's executive order. The governor put it out. We are students and we're servant leaders of the government, so therefore they have to be enforced. Now, how you do that is where the community policing part goes in. Everybody's on edge. The whole world's on edge. And we've instructed our officers when they see something, have a friendly conversation to make it a teaching moment. But ultimately, if they say, it doesn't matter, I'm going to do what I want to do, that's where the governor has put in, backed up by the Attorney General, Dana Nessel, that they will issue a misdemeanor ticket and have to go defend that. I also have warned businesses, many of them, that if they are operating outside the governor's guidelines and there is an accident, their liability insurance will not cover them, I'm guessing, because they were operating outside their guidelines. So there's the civil side of it that they're taking a big risk on. As far as the curfew, we've talked about that. It's a community policing circumstance. We've not had any big problems with that, but it's the businesses. I get it. People are losing their businesses, and it's everybody's paying for something, and everybody's going to lose something on this pandemic. But the enforcer said, the enforcement. I have a point home that everybody knows they have to sacrifice. So we're stopping people. I would say call your local police department. In local police departments, this is my challenge. It's not comfortable. You know who these business owners are. You still have to carry the message of the governor.
Right. And I want to just add to that for businesses, Margie, that there have been a couple pots of money put together from the state of Michigan and also from the federal government that people and businesses can apply for. They have grants and also small interest loans. And if you need help to find where those dollars are and how you can apply for those dollars, if you have a small business, we don't want our small businesses to close as a byproduct to this pandemic. We have lives that's lost, and also we have business life that is critical as well. But they can call Kelfani Stevens here at the City Hall at 237-0297. That's 237-0297. He's our economic development lead on those activities. You can get small interest loans from the state of Michigan, also grants from the state of Michigan, and also you can get them from the federal government. And we can help you here to make sure your business does not fail as a byproduct of it. But make no mistake about it. If you are inside the jurisdiction of the city of Flint and you are producing and conducting activities that's not conducive to safeguarding lives, you will get a visit by the police or whatever means that we have to do to make sure that we protect the residents outside the city of Flint. And I don't want to seem harsh, Chris, but sometimes we have to make a strong message here to saying that life is important. Deficits, financial deficits, you can overcome. But there's one deficit that you can never overcome, and that's a death deficit. Right. And we don't want to lose one life or the potential that that person could have poured into our community. And we will work with you in partnership to make sure that we come out on the other side of this whole as a business and as a community. But definitely, please, everybody has to observe this because we are a sum of all of our parts. And then if one part of us is sick, all of us are sick. So we need to make sure we continue to do so. Margie, back to the Facebook question.
Building on that a little bit, there were a lot of questions about the curfew, Mayor, that wondering if you can actually address too. I know that the police department reported a lot of improvement immediately after that executive order came through, but there are still residents who are concerned about what they are seeing and hearing around their residents. Any advice for them if they have concerns about the curfew and possible violators?
Well, this thing, and Chris is the law enforcement specialist, so he can help me here. But we don't want people wearing masks out after the hours of 9 p.m. at night. You know, it's a lot of nefarious activity that can occur during that period of time. And people sometimes they engage in that. That's just a part of society. And so we want to make sure we safeguard everyone inside the city of Flint and protect them from this virus and also from people that has nefarious intent in their hearts. And then, can you piggyback on that? Yeah, we got to work.
Conference Chief Hart. Okay. I'm sorry. I just want to add to that at the mayor's request. Last week, we had a conference call, myself, Chief Hart, Deputy Chief Bernritter from Flint City, as well as Yvonne Brantley, the first lieutenant of the state police. And everybody's on the same page that just obey the curfew. Then you won't have any law enforcement interaction. When you do, The Flint Police Department is the first line. They're going to go there. Deputy Bernritter even mentioned he's instructed all his command staff to instruct their lieutenants and sergeants and police officers to go have a conversation to shoo them out. And that's what's been happening. But if they are being pushed, if we are being pushed, if the state police or any jurisdiction that comes in to back us up, that's the enforcement side. We would much rather people obey the curfew rule, obey the stay at home for the good of community, a good of human, your human dignity than be enforced. But worst case scenario, that's what we have to do. And we'll continue to do that.
Very good. Let's try to get through just a couple of more quick questions. Ms. Steward, if you're available, one of the questions too was about Flint schools, and just if we have any idea on how much need is out there within the school community for the kids to have access to technology. Do you have an assessment on that at this point?
We are currently doing an assessment to see what the needs are of the students as far as technology. We do know that we have about 27% of our families who have reported that they have technology and internet service. We're also doing an assessment of what we're calling tier 2 and tier 3 families, because we know that we have some families who have internet service, but they don't necessarily have the technology. And we have some families who have technology, but they do not have the internet service. And so we have what we have established as a wellness team that have been contacting our families to see what their needs are, both mentally, socially, as well as any technology issues that they may need, so that we can help those families navigate through those barriers. And so it is our goal that as of April 15th, we will have some hard data around, or some concrete data around the assessment needs as far as technology and internet services for our students.
Very good, thank you. And then, Mayor, one question came up about income taxes and if the deadline has been altered at all for the city income tax.
Yes, by the executive order of Gretchen Whitmer, which is our governor of the state of Michigan, we have moved the deadline back. The deadline has been moved back by one of the executive orders. It's been moved back to July 31st, 2020 of this year by the executive order of our governor, Gretchen Whitmer. And you can always go to our our web page, the City of Flint, to look at these, and also to the web page of the state of Michigan to get the current information that we need. But moreover, we want to make sure that we address all the questions and even the hard questions that may come up. And Dr. Reynolds, some people have been seeing that this testing from the COVID-19 testing, and they also see that drive-up testing and these things have been done. And we don't want to shy away from those type of questions, but people have to understand about resources and availability of medical professionals to be able to administer that, and also the equipment. And it, through my tutorials of it, getting it from all the professionals about the reagents and the reactors and the equipment to be able to do this, and who's being tested and why. Because people, I know you're concerned, but to have a drive-up testing site. But if you can speak a little bit more to that, I know that was a pressing question for some.
In order to do any testing, as you said, you have to have the right test. You have to have the right equipment, even the right swab. If you recall, we moved from using a deep swab that went through your nose to the back of your throat to a nasal swab. But you must have the right swab for the right test. And then you put it in the tube for shipping off to processing. Then you need the right chemicals to perform the test once it reaches the lab. So it's very complex. So with such a worldwide demand, these supplies are not available readily. These reagents or these chemicals are not available readily. We hope that at some time in the future, they will be. I have a colleague who actually had the equipment to do the tests, and he was able to do it for a couple of weeks, but his testing staff became ill, and he had to shut down that part of his office because they had to go into quarantine. So it's not just what we want right now. And I know it's hard and difficult under these circumstances to say, be patient. But unfortunately, we have to be patient, and we have to look out for those who are more ill than we are.
Right. And as I've been gleaning information, it's like the frontline fighters are the ones who are getting tested more regular than just the general population of the public if they're not symptomatic and they're not going into the ER room. Is that the understanding that we have, Dr. Reynolds and Chris?
I'll let Chris speak first.
Chris, are you there?
In fact, we'll work with Hurley right now. Are you okay? Can you hear Marjorie?
I think the sheriff might be having
Marjorie,
a little bit of
can you hear
trouble
me?
with his Wi-Fi connection.
Yeah, we can hear you, Chris. Go ahead.
Can you hear me okay?
Yes, go ahead.
The short of it is we are working, and it's been about a week and a half now. Hurley Hospital has a line to test not only our critical care nurses in the hospitals, but also our EMS. And it tests if you have had it through the antigen test, as well as if you currently have it. We have not been able to do that. The only thing we're able to do, just like Dr. Reynolds said, because of availability, is to test people that are symptomatic. But we're hoping to go back and test to give that sense of peace for a lot of these first responders that may have had it and they didn't even know it back in November, December, January, February. 13% chance they would get it again. That can settle a lot of nerves with people that are dealing with COVID patients every day. But we don't have that yet in our system here in Genesee County and the city.
Right. Dr. Reynolds? It looked like we may have lost. Dr. Reynolds, are you there? Okay. So.
Okay. Well, one more thing, Mayor, before we move toward wrapping up here. One of the questions is for individuals that maybe still need water filters or any people that have concerns about those who may not have water service. Could you offer some additional information on how people can get help with that?
Yeah, we have ramped up the service here in the city of Flint, being proactively engaged in making sure that we can slow the spread of this deadly virus. On March 12th, we engaged in a process of making sure we continue water deliveries for the most vulnerable. Not on March 12th, but that activity is engaged right now. March 12th, we engaged in actually restoring people to the system of water inside the city of Flint through my entire administration, which is 5 months now. We have not disconnected one user, but we are now reactivating users that was disconnected from the system to make sure they have a sanitary environment, whether to wash their hands and bathe and make sure they can slow the spread of the virus. All they have to do is dial 810-410-2020 in order to get on that list. And also by the executive order of the governor, the state of Michigan, those activities have been reinstated. Also, water filter replacements. If you already have a water filter and you need another water filter, if people in our health, we have health navigators inside the city of Flint. We have them there working very hard in their frontline fighter under the leadership of Billy Mitchell and DeVal Murdoch. They're doing a fantastic job. Just call that same number and we can get the filters delivered to your home. Water testing kits. We're still engaged in a water crisis inside the city of Flint. In order to make sure that you know that your water source is safe at your home, that's coming through your tap, only way we can really know that is to actually test your water, and you can dial that one number that we have for all these activities. And we ask you to be very patient as it relates to when you call in for services for reconnections, water deliveries, filter deliveries, water reconnections, or payment assistance programs. It's one number, but we have a team of individuals to respond to you and your needs. 410-2020. We want to thank our partners in the help centers. We want to thank Bishop Jones and Mother Jones at Greater Holy Temple. We want to thank Harold Woodson over at Bethel United Methodist Church. We want to thank Asbury Church. We want to thank all the volunteers that's coming out to really be the frontline fighters. All of those who are coming together and staying together and working together. And, you know, one of the things I like to say, you know, coming together is a start. Yeah. Working together is progress.
That's right.
Staying together is success. And so I'm asking everybody from every sector that can hear this or that you can repeat this to them. The only way that we can win is if we do what the health community is telling us to do.
Right.
wear face masks, wash your hands, practice social distancing, shelter in place, and staying off the street in public places, and then giving all of our frontline fighters, our nurses, our doctors, our EMS techs, our police and our fire, our grocery store workers, our bank clerks, our fast food clerks. These are frontline fighters because they out there risking themselves every day. But we can only win together. I'm asking people in the faith community. We have more than 400 churches in Genesee County. And so if you know a pastor, bishop, rabbi, or if I missed it, I apologize. But make sure that we do everything that's possible to slow the spread of this disease. It may be uncomfortable moments. It may be a level of fear. It may be some situations that is just not practical, but due measurement of strength. Let's be disciplined as a community. We're going to be here fighting for you. I want to thank Garlin Gilchrist, Lieutenant Governor. I want to thank State Representative Cynthia Neeley. I want to thank Dr. Lawrence Reynolds. I want to thank Sheriff Chris Swanson. I want to thank Deputy Superintendent Anita Steward. I want to thank Mrs. Houston for the harder hearing. And what was his name again? Was it
Miles?
Miles. I want to thank Miles. And I want to thank all of you for being so diligent. And with that, I'll give you an opportunity, Chris, Anita, and Dr. Reynolds to close out.
Thank you. Who wants to go first? Ms. Steward? Who do you want,
Go
Mayor?
for it. Chris, you're already talking. Go for it.
All right. I just want to say this. On a personal note, I just took a screenshot of that $75 water credit. My dad's 81. My mom's 80. They live on the west side. They are simple people that work hard. That's the kind of stuff that's going to give them relief. So I appreciate that from my own Swanson family. Second thing, there's one virus that's invisible that's even worse than Corona, and that's when every sit of fear is hope. And it can't be a better weekend on this weekend of Resurrection Sunday to have and to have hope in the faith community that's going to be there for you. And you're a faith-based man. I know there's believers that are watching. Have hope that tomorrow's going to be better today. That's what's got this whole country through all the other past struggles, and we're going to do it again. I believe it. We're on the back end, and we're going to have hope that it's going to be better one day soon. Thank you.
Anita?
Thank you, Mayor Neeley, for your service to the citizens and the community. I thank you for your partnership and for everything that you've done with Flint Community Schools. Flint Community Schools is honored to be able to work alongside of you, as well as the rest of you in whatever it is that we can do. So once again, I thank you for your partnership and for everything that you've done for Flint Community Schools.
Dr. Reynolds?
I want to say this is a new normal. And that means the things that we operated on under 2 weeks ago no longer apply. We have to come up with new solutions because this is a worldwide pandemic, number one, and number two, with a new virus that we have no experience with. So be patient with the experts when they say one thing one week, but they find out something new the next week. And be careful, because people will tell you, oh, we know this is going to die out before summer. We don't know enough about this virus to say that. So listen to the folks who know, and we will let you know what we know.
Right. And Margie, I want to thank you, for our comms director for the city of Flint, for putting this together and making this this experiment to get to our residents. And we'll do this again as more information comes about, but please observe all the things. The healthcare disparity clinic that was talked about by Representative Cynthia Neeley is moving into place. We want to thank First Trinity Church, the Pastor Tillman and Lady Tillman. We want to thank Pastor Hawkins and April Hawkins. We want to thank Pastor Daniel Moore. We want to thank all of our partners, and also a new company that we're going to be contracting with to do health screenings. And Chris, you know about this. We screen our employees every day, our first responders, making sure. We want to thank Universal Medical and the Kidney Foundation, Universal Kidney Foundation, for being a part of our new health team that we're going to be engaging, making sure that our employees are safe and to be assured when they engage the public that they have been pre-screened on that particular day, not to be symptomatic for the virus. And so We were doing everything to slow the spread of this virus, and I don't think I forgot anything. Margie, have I forgotten anything?
No, we did good. We got through some of the Facebook questions. So I think that's helpful. I think just if you have any last words, I know it's Holy Week and a lot of canceled celebrations out there this weekend. So if you have any advice for folks on whether they should gather or not this weekend, and then we can close it out because it's been about an hour and a half.
Right. Well, as Chris Swanson, our sheriff, has said, hope is a prerequisite of faith. We have to have faith, a strong faith, to get us through these particular times. We have to embrace those things and grab on those things as an anchor to get us through these very, very difficult times. This is real. Please take this serious. So parents, keep your children out of those common public places where they can come in contact with this virus. I don't care if people are on playground. This virus has been known to stay on objects for up to 24 hours or a little bit longer. They will be taking that virus into the homes and infecting grandma and grandpa. We have to go through these uncomfortable moments to get to the other side. So we want to make sure that we get this. And so people of faith, even if the pastors are saying, and I don't want to get in trouble, that they're opening church on this Sunday, please practice shelter in place, because this is the only way that we're going to get to the other side. And people in the faith community, encourage your colleagues to be able to say, hey, just close the doors for a week or two and let's pray at home. God sees you where you are. God hears you from where you are. So let's do this, because we have a strong, resilient community. And I can't thank you guys enough, but we are our own defenders. Practice social distancing, wash your hands, cover your face, do all the things the health community has advised you to do, and cough into your arm, and then wash your shirt after Dr. Reynolds had done that. Chris, let your parents know that you will be paying their full bill for them this month. And that's the Swanson plan. So with that, I want to thank all of you, and God bless you. Thank you, Governor Garlin, Gilchrist, State Representative Cynthia, Neeley. Thank all of our partners, Chris Swanson, Dr. Reynolds, and Anita, Steward, and Margie. Thank you for doing a fantastic job, and thank all of you. And I hope we've answered your questions. If not, call the City of Flint. If you have a business need or another concern, call the City of Flint, or go to the Flint Community Schools or the county's webpage to find out what you may need to know. Thank you, guys, and God bless you.
Thank you.
Thank you. Thank you all. Well, I will go through and continue trying to answer some of the questions on Facebook, everyone, too. So thank you all. Good night.
Good night.
Good night. Thank you, Marjorie. Thank you.